Hello and welcome. My name is Alyssa Maurice. I'm the Research Associate at the William J. Hughes Center for Public Policy at Stockton University. We're here today to talk about a research report recently released by the Hughes Center examining the impact the COVID-19 pandemic had on mental health and mental health treatment in the state of New Jersey. But before we begin, I just want to give some background on the Hughes Center. So the Hughes Center mission is really to provide a forum for the discussion of issues that impact New Jersey residents. One of the ways that we do this is by sponsoring research projects that aim to educate the public and decision makers about important topics, which can then inform policy. So this allows us to incorporate the expertise of our Stockton faculty and to give students the opportunity to engage in research, which we believe really enriches their academic experience. So the report that we're here to talk about today is really a prime example of that effort. It was conducted over the course of a year by Hughes Center Research Fellow and Stockton faculty, Dr. Justin Ostrowski, and his team of Stockton student researchers, co-authors Keith Jennings, Matthew Crilly, and Anna Caputo. So they're all here with me today to talk about this work, so thank you all for being here. I want to start us off with some brief introductions. So if you each could tell us a bit about yourself and what drew you to this particular project, that would be great. So Professor, we'll start with you.
I'm Dr. Justin Ostrowski. I'm an associate professor of psychology at Stockton University, a PhD in experimental cognitive psychology. During the pandemic, I noticed a lot of people in my life and people I worked with that seemed to have, worsening mental health while the pandemic was ongoing. And I was just interested in determining, whether that was representative of the state as a whole. And how people were seeking treatment.
Hi, my name's Keith Jennings. I was mostly just interested in the fact that it seemed like demographically there was very different people that were having a very disproportionate negative effects when it came to the pandemic in particular. It just seemed like it was not a pandemic that was hitting everyone the same. It seemed like it was very disproportionate, and I just was really interested to see how that actually played out within our state, nationally, globally, and all that. It just seemed very interesting.
My name is Matthew Crilly. I just recently graduated this past semester with a bachelor's in psychology. My main reason for joining on this research project was really to get research experience. It's brand new to me, and it was just something I've never had before. And the topic itself, I think is just really interesting. I think it's fascinating to look at mental health during COVID, because you hear a lot of claims from different individuals on it got worse or it got, back and forth. So it's pretty neat to be able to actually put some numbers to that and sort of set it up so we can kind of draw conclusions. So yeah.
Great. Anna?
Hi, I'm Anna. I also recently graduated this past semester with a bachelor's in psychology, and I was really interested in this project not only to gain more research experience that was different from my previous research experience, but because COVID had been a topic and still is a topic of conversation, I really wanted to look at the real and raw data that was publicly available and actually see what patterns we were able to tell from data itself and kind of compare it to what other people from word of mouth were saying and compare it to nationally as well.
Thank you all again for being here. I want to just zoom out for a moment and ask, what was the goal of this study? What was it trying to accomplish? And can you also walk us through the approach and tell us a bit about how it was conducted?
So the COVID-19 pandemic had profound effects on the physical health, economic well-being, and social life of New Jersey residents. So our research was mainly focused on assessing whether these life changes associated with the pandemic were also associated with changes in New Jersey residents' mental health and how they obtain treatment for any mental health problems they may have experienced. We particularly focused on assessing how depression, anxiety, suicidal behaviors, substance abuse problems, and child abuse changed during the pandemic years relative to pre-pandemic years. We also focused on pandemic-related changes and how individuals sought and obtained mental health treatment. We assessed the rate to which New Jersey residents sought and obtained treatment, the degree to which individuals did not receive treatment that they felt that they needed, and the degree to which there are shortages in mental health professionals that are practicing in the state. So by doing this research, it was our hope that by publicizing the facts that we uncovered in our research, that public policy could be further developed in the state to ensure that less people are experiencing the mental health problems that many individuals are facing, and that more people who need mental health treatment are able to successfully obtain high quality care. In terms of how we went about conducting our research, we used three primary methods. The first method was in collaboration with the Polling Institute of the Hughes Center by conducting a poll of New Jersey residents in March and April of 2023 that asked individuals to report how they felt the pandemic affected their mental health, substance use and abuse, and their need and ability or lack thereof to obtain mental health treatment. The second method we used was to perform novel statistical analyses of many publicly available data sets that allowed us to perform New Jersey specific comparisons between pandemic and pre-pandemic years with respect to many different aspects of the experience of mental health problems and forms of mental health treatment. And the third method we used was to summarize published research that allowed us to compare what we learned about what was going on in New Jersey to what was going on in the nation and also in the world, since the COVID-19 pandemic was really a worldwide phenomena that affected everyone. So we wanted to, once we understood what was going on in New Jersey, we wanted to look and see how whether those observations were either unique to New Jersey or were more representative of what was going on in the nation and the world at large.
Now, I know this is probably tough because there is so much depth to this research. So I will actually take this opportunity to encourage everyone to read the full report on our website after this video. But could you please highlight some key findings for us?
For section 2, we basically just observed mental health generally, in particular anxiety and depression, suicidal ideation, attempts of suicide, all increased substantially, and especially in a few demographics. And for suicidal ideation and attempted suicides, we saw modest gains in both of those. Beyond that, we asked New Jersey residents in the poll about their alcohol and recreational drug use, and that also increased with 40% still today, saying that their elevated rates that started during the pandemic still persist today. So that's pretty substantial. But it's important to note that when we look at beyond just New Jersey, internationally, it seemed like it was felt everywhere. Some countries didn't see it as harshly as we did, and some saw it even worse than we did. But for instance, like symptoms of anxiety increased from just 8.2% pre-pandemic in United States to about 30% in 2020. But if you compare that to like United Kingdom, which is like probably the most comparable EU country, I would say, it's pretty similar. You saw similar trends with depression as well. And that was across most of these nations. You even saw somewhat similar trends in Asia and Latin America. So it seemed like the pandemic really hit everyone pretty bad globally.
My part was also in section 2. So basically, a lot of the information in this section was done by the Hughes Center poll. That's where we pulled a lot of that from. I'm not going to go too much into the actual numbers themselves, but there were a lot of interesting findings, and I think Keith mentioned quite a few of them, so I'll kind of build on them. So when asked if individuals felt the need to obtain mental health treatment during the COVID pandemic, regardless of whether or not they actually did obtain it, approximately 21% answered that yes, they felt the need to get that treatment, which you're looking at about a fifth of our survey takers, which is interesting to say the least. We broke that down by age group, and like Keith already mentioned, there's a pattern where the younger individuals were more likely to express that they felt they needed mental health treatment during the pandemic. And so of the individuals that answered yes, they felt the need to obtain mental health treatment, you had about 40% that indicated that a fear or anxiety is what we called it about COVID did impact their decision in seeking that treatment, which I think that's pretty large. That's people admitting right there that there was a pandemic influence regarding treatment. And that did kind of go either way. But so I think the takeaway for that really is just that 40% of this group that we had of that specific group were individuals who expressed a need for treatment and who had their decision influenced by the pandemic. Moving on, we had the methods of obtaining mental health treatment with an emphasis on telehealth treatment. That's our next section that I'm going to cover. And so again, this was Hughes poll data, and we kind of compared it to a telehealth tracker that we do cite in our paper, as well as the National Mental Health Services Survey. So for New Jersey specific, in 2020, there was an approximately a 250% increase in the number of mental health facilities offering telehealth services, and that's compared to 2019. Now, I do want to put that in a different light. Basically, we go from having 56 facilities in 2019 that are offering mental health telehealth up to 196 facilities in 2020. Of all Northeast mental health treatment-focused telehealth claims in 2021, the three most frequently treated were, from most to least, anxiety, depression, and then adjustment disorder. And so it makes you question whether or not there are certain mental health diagnoses that kind of translate well to this telehealth format. Wrapping up here, I do want to touch on the reception. Basically, based on our Hughes Center poll, approximately 70% of respondents who obtained mental health treatment did so telehealth. Breaking that number down, when individuals were asked to actually talk about their experiences with these services compared to the in-person, you had approximately 43% saying that it was about the same experience as in person. And then only about 18 said that telehealth was worse. Which again, all things considered, and what a massive change it was, I think that is just a really positive thing to say. And I think that about covers it for my sections.
Oh, I'm going to be talking about the section about unmet demand for mental health and substance abuse treatment. And to kind of define what the unmet demand means, it means people who wanted to have treatment such as counseling or therapy or substance abuse treatment specifically, but they did not end up receiving that treatment. And so starting off with the mental health section, between September of 2020 and April of 2022, the New Jersey residents who wanted or needed counseling or therapy but didn't receive it ranged from about 6.8% to 10.7%. But what was interesting to note was that the New Jersey percentages were consistently below the national percentages throughout this entire time frame. And we saw that national percentages ended up reaching like highs of about 12.2%. And we broke this down demographically as well. So there were certain age groups that were affected more by this unmet demand than others. The 18 to 29-year-olds had the greatest percentage, followed by the 30 to 39-year-olds. And the age groups that were not as affected by the mental health unmet demand were people who were 70 or older. Breaking it down by race, the New Jersey residents who identified as other or multi-race had the greatest percentage of needing or wanting counseling but not receiving it, and they had a percentage of 16.4. On the contrary, individuals in New Jersey who reported being Asian had the lowest percentage, which was 6.7%. And then looking at it by male and female, females also did have a much higher percentage than males did for the unmet demand. And then moving on to the substance abuse treatment. So the percentage of the annual unmet demand for substance abuse treatment stayed around the 40% mark from 2016 to 2019. But then when you look at the increase from 2019 to 2020, there was a 61% of needing the substance abuse treatment, but not receiving it. And this stayed in 2021 as well. We also broke this down by New Jersey county. And we saw that 17 out of the 21 counties in New Jersey had an increase for unmet demand for substance abuse treatment itself from 2019 to 2020. And there were a few counties that had a very large percent increase, and the top three were Cumberland with 149.6%, Mercer with 121.9%, and Salem with 120.3%. So we can really see that there was something pretty substantial happening between 2019 and 2020, which we think may be COVID, that was having people have this need. And it's kind of disheartening to see that it was that much of an increase, that this demand was like really unmet for them. And then when we look at the percentages by county for the year of 2021, this is just looking at the annual percentage itself, not an increase. But for 2021, the top 5 counties that had the highest percentages of this unmet demand were Mercer, Monmouth, Burlington, Sussex, Warren, and Somerset.
Great. Well, thank you for that summary. I want to switch gears now and just talk about the process itself. And, this question is for the student researchers. So Anna, Matthew, and Keith, what was the research experience like? How do you think it added value to your academic career?
I would say this is perhaps by itself more valuable than nearly every other class I've taken at Stockton, I think, because it was just everything I've learned and then some I had to put into this paper. The amount of pages we wrote collectively is just, I'd never thought I would have written anything like this until I got into like a PhD program. So this was massive. It was a great experience overall, is all I'll say. Is the best experience I've had at Stockton, I think, in terms of research experience and bettering my actual practical knowledge.
Kind of build on what Keith was saying. I came into this as a complete newbie regarding research. And I think it was just a nice, it was a dose of reality of what these projects can be. This was a very hands-on, we're doing everything, we're working on a team, we're doing our homework on the background topics, we're making our graphs, we're organizing our data. It was a really good experience. It was fun in a challenging way. And I think also, like Keith pointed out, you learn a lot as you go. Again, I kind of went in not knowing a whole lot, but I was able to start using SPSS to look at some data sets. We used Excel for our graphs and just organizing our data in ways that I had never seen before. And so I'll just say overall, it was a fantastic experience. It was a lot more than a single class I feel would be able to give you. And so I'll just say for students who are thinking of doing it, if you have an interest in research, I think it's a fantastic choice to make, to try to get involved like that, get that experience, and decide if it's for you.
I really liked having experience learning how to time manage by analyzing multiple data sets at one time in one deadline constraint. I know that I'll be able to use those skills in my future when I'll have to work on a lot more data sets at one time. And being able to create all the different graphs I found really fun. I really like creating visuals for data, and I was able to learn different techniques, kind of learn what was good for a reader, what was not. You learn how to make a graph that really tells the reader the point that you want to make and can deliver that point to anyone, whether they have research experience or not, but still make it look appealing so someone will want to look at it and be engaged.
That's wonderful that you all had that experience. So as I mentioned earlier, the Hughes Center sponsors this sort of work to inform and engage the public. So now that it's complete and the paper is published, what do you hope people take away from this work?
Given the observations we summarized that indicated worsening mental health for many populations within the state and reduced access to mental health treatment during these pandemic years, we believe our research indicates a need for the state to further invest in the mental health care system. One way this could be accomplished is by funding research that aims to understand why these types of mental health problems seem to be on the rise and how to treat and prevent them more effectively. Another way this could be done is by having the state focus on developing and investing in methods to increase the mental health care workforce in the state, to reduce the type of shortages in the number of professionals working in the mental health care system that I alluded to earlier. Third way this could be done is by investing in programs that more effectively treat addiction and increase the safety of drug use for those who are using these types of dangerous drugs and struggling with their addiction with them. A fourth way this could be done is by increasing the funding for long-term inpatient residential forms of treatment. There was pretty dramatic reductions in the number of admissions to state psychiatric hospitals during the pandemic, and that persisted into 2021. We summarize in the report how this may be resulting in overburdening general hospitals. And even though this wasn't touched upon in the report, I was thinking after writing it that this might also be overburdening prisons' roles in treating mental health, because a lot of times people that have severe psychiatric issues that don't get treated sometimes get caught up in the criminal justice system and get imprisoned, and prisons are just not optimal environments for mental health care. And springboarding off much of what Matthew said in terms of telehealth treatment, it seems that telehealth is here to stay. Telehealth, starting in 2021 and 2022, is primarily being used for mental health treatment compared to other types of medical treatment. To me, it seems like there's a lot of benefits to it. When you think about rural communities where people living in these types of environments just find it geographically challenging to, drive long distances to get in-person care, it would seem that, online telehealth services could really expand the population who can easily obtain high quality care. So further investing in telehealth mental health treatment might prove useful. So whether that be by funding research to see if telehealth can be used to treat other types of mental health problems beyond the most common ones being depression, anxiety, and adjustment disorder. Also, in terms of training, I would imagine that there's probably different challenges when, offering in-person versus telehealth treatment. So as telehealth becomes increasingly more common as a form of treatment, perhaps the training of mental health care professionals might want to have at least some sections within the curriculum that are really specifically focused on the unique challenges of telehealth treatments.
Great, thank you. Well, I think that's a great message to close on. So I want to thank you all again for taking the time to talk more about this work. I encourage everyone to please head over to stockton.edu/Hughes Center to read the full report and learn more. So thank you all and take care.